Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood. And today our very special guest is Hannah Masanotti, and she's with Houston Music Therapy. Good morning.
Good morning.
And so today we're going to talk about the benefits of music therapy for children that have special needs and how they can access services. But let's kind of back up just a little bit and then for our listeners, and let's talk about what is music therapy and what kind of qualifications does someone have to have in order to be able to give those kinds of services to someone that has a disability.
Absolutely. So I like to explain, or I guess describe music therapy as a healthcare profession where specially trained and credentialed professionals manipulate the different aspects of music for very specific therapeutic benefits. So they work in a very wide variety of settings, all the way from the NICU all the way through to end-of-life hospice care and everything in between. So we work with infants, children, teens, adults, and older adults in medical, educational, home health, psychiatric, long-term care, all kinds of settings.
Oh, that's great.
Yes.
But specifically for children that have disabilities, what kind of benefits does music therapy offer them?
Yeah, so for communication, we do a lot to support that, from receptive to expressive skills and even nonverbal communication. We have a young client right now who started just this past summer. And when we first started working with him, he was just not using his words, and his mother really wanted him to be able to ask for what he wanted to eat and let her know when he was thirsty and things like that. And just since then, he's just blossomed, and his mother is just thrilled with the progress he's made. He's able to more independently make requests and answer simple questions, and she's just ecstatic about that progress. So that's one area. We also address cognitive skills, things like attention, memory, academics, especially in the school setting, as well as social skills, adaptive behaviors. Reducing unsafe behaviors is another area that we help address, as well as regulating emotions and motor functioning, as well as sensory processing.
Okay, I don't mean to throw you off, but I'd like for you to kind of give me an example, maybe. Like, what type of music does the music matter as far as what you're trying to accomplish? I'd really like to dig just a little deeper, if you don't mind, because
Absolutely.
I find this very fascinating. I mean, I love music, and you've always heard, lots of good things about, specifically with people who have Alzheimer's, that music, a lot of times they can sing songs and remember all that stuff, because music is such a huge part. But I'm really curious to see, if you're trying to fix behaviors and things like that, does it matter the different types of music, and how does it kind of give me the really tiny, spill on, do you just play some music and then, kind of give me an idea of what it looks like for our listeners?
Absolutely. So it really is very individualized. We do an assessment and look at the way the client responds to the music, and then we use that to inform what we do with that client. There are also very specific ways music impacts the brain and its functioning. So I'll just give a few examples to kind of paint a picture. But we might work on physical endurance or range of motion by playing a drum, or listening to music to help support emotion regulation. So a song that is soothing for a child can be used in that way.
Okay. All right. That makes sense. Do you play lots of other instruments?
Yes. Especially things like working on social interactions or even attention or memory. We might play instruments or sing together to work on communication, whether it's increasing vocalizations or even working on speech articulation, usually under the guidance of a speech therapist in that case.
Wow.
Yeah.
So how do children participate in music therapy? Is it something they have to make an appointment to come see you? Is it have to be doctor prescribed? I mean, how do they get to you to try it out?
Yeah, so there are a lot of different settings that music therapists work in. We are in public schools, so there are very specific guidelines that the Individuals with Disabilities Education Act, I believe is what it's called, IDEA. It mandates different services in the special education setting, and music therapy is considered a related service in that case. But we also provide services in homes and in a variety of settings in the community, such as even daycares, group homes, day hab facilities, pretty much any setting you can think of. They may already have a music therapist on staff, or they may be able to bring one in from the community.
So how does someone find out if music therapy would be beneficial to their children or patient or student or somebody like that?
Yeah. So, sorry, I'm just checking my notes to make sure I got information here. Yeah. Yeah, so you can start out by seeking out a music therapy assessment. If you notice that music seems really motivating to your child, or if maybe they pay more attention to information when it's presented musically, as well as if it's soothing, or if the child becomes more socially interactive within a musical context. Those are all signs that music therapy may be appropriate, but you would want to seek out an assessment to determine for sure. And that includes having a music therapist come gather some background information, ask questions of the parent, caregiver, other service providers, and sometimes the child, depending on the specific child. And then we interact with the child, see how they respond to the music, look at their strengths and needs, and then we write a report and making recommendations with individualized goals based on those results. And that's really, through that process is how we determine when somebody may be appropriate for music therapy.
Is music therapy covered by insurance or Medicaid or something like that? So, or is it private pay? How affordable is it?
Yeah, so it's very affordable. As a service, a little bit really goes a long way. So it's rarely needed more than 2 times a week. And oftentimes just 30 minutes once a week can be effective. So in that way, it's very affordable. It's also very streamlined, can address all those different goal areas just within that one session each week.
That's awesome.
Yeah. And in terms of funding, it often is out of pocket, but there are a lot of different resources and options available to help pay for it or even cover the cost entirely. You mentioned insurance. That's still something we're working on. We're always considered out of network, but there are insurance companies who do cover. It's just, you would want to check with them and verify that before seeking out the service. In Texas, the CLAS and YES Medicaid waivers do cover music therapy. So if you have a child in one of those 2 settings, one of those 2 programs, they can get that funded. There's also a lot of grants. We have a page on our website that lists a lot of different grants for music therapy. So I encourage you to check that out, HoustonMusicTherapy.com.
So how far is your reach? So, like my office is down in Clear Lake, in the Clear Lake area of Houston. And so how far, how does someone find it? So, how far do y'all travel, with your company, or is there a particular place they can go to find someone that may be closer? How does someone go about finding a music therapist?
Yeah, so we serve in homes and facilities around the community, all the way from Spring and the Woodlands down to Pearland, Baytown to Katy, and everywhere in between. And we have connections with other music therapists. So if we're not a good fit, you're still more than welcome to reach out to us, and we can help you find somebody who would be a good fit. But as far as finding a music therapist, if you're looking for services in the school, if your child has an IEP, then you can request an evaluation for music therapy and see if they qualify. The guidelines are very strict for whether or not they qualify, but it's everybody is able to get an evaluation at the least for that. You can also, if your child is in like a daycare or goes to a therapy clinic for other therapies, it would be worth reaching out and asking them if they have a music therapist. And if those don't work, you're more than welcome to reach out to us at Houston Music Therapy or search musictherapy.org. That's our professional association for music therapists in your area.
So Hannah, one last question. What drew you to doing this kind of therapy? Because it's not something you hear a lot, So I'm curious to know what was your passion when it came to doing this particular thing.
Well, I'm neurodivergent myself. I have a lot of disabilities, some learning disabilities and things like that. And music was very impactful for me in helping me connect with my friends and feel accomplished, even though there were areas where I struggled. So, and I studied music starting at 5 years old and got my undergraduate degree in music. So it just seemed like the perfect marriage.
It does. And so that's awesome. I just want to thank you so much. You've been a great guest today and appreciate it. And if they want to get in touch with you, how do they do that?
You can go to houstonmusictherapy.com or email us at info@houstonmusictherapy.com or give us a call or text message at 713-570-6368.
All right. I appreciate it. Thanks so much for being on the show today. It's such good information.
Yes. Thank you for having me, Kim.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.